Today we have Dr. Nishi here with us. Would you like to introduce yourself?
I'm Dr. Nishi Bhopal. I am a psychiatrist and a sleep specialist, and I also practice integrative holistic medicine.
So do you see a lot of your patients that have anxiety who also experience insomnia?
Yes, people who have anxiety have higher rates of insomnia. And then people who have insomnia who maybe didn't even have anxiety before are at a higher risk of developing anxiety. Because when you're not sleeping well, you actually get more activity in the amygdala, which is kind of the fear and anxiety center of the brain. So part of dealing with insomnia, if you have anxiety, is really learning how to calm your nervous system during the day. So if you can focus on these three pillars, your sleep drive, circadian rhythm, and regulating your nervous system during the day, that's going to set you up for better sleep at night.
Have you noticed, Dr. Nishi, like some people who experience insomnia, they're so hyper-focused on trying to sleep that they do all the right things, but it turns into an exercise that is more a means to fight themselves into sleep.
Trying to make yourself sleep is like trying to make yourself eat when you're not hungry. It doesn't work. Everybody has sleep issues once in a while, but people who make sleep a problem are the ones who struggle, because that perpetuates that cycle of insomnia. Now, for people who are really struggling with that anxiety about sleep and they just can't get past it, this is where cognitive behavioral therapy for insomnia is really helpful. When people don't sleep well, the tendency is that they spend more time in bed, hoping they're going to get more sleep. But actually, that is counterproductive, because the more you're awake in bed, you're actually training your brain to stay awake in bed. And so we want to break that association by spending less time in bed.
From my personal experience, Dr. Nishi, I remember when I was going through insomnia, lying in bed thinking to myself, oh God, tomorrow is going to be awful. And it was not awful.
This is where our thoughts are so important. It's so important to be mindful of how we're starting our day and the types of thoughts that we're kind of focusing our attention on. We want to look at the nervous system, the autonomic nervous system. There's the two branches, the sympathetic and the parasympathetic, right? So the sympathetic is your fight, flight, and freeze response. And that's what we get into if we're feeling a little bit anxious or overwhelmed or worried. And then the parasympathetic is the rest and digest response. And that is what is active during sleep. So we need to go into the parasympathetic nervous system in order to fall asleep. But the more we try, the more we get into that sympathetic nervous system. And this is where the thoughts are really important.
So we talked a little bit about what to do when we're worried about not being able to fall asleep. But a lot of people, they are able to fall asleep, or just before they fall asleep, they wake up by an adrenaline jolt. So what's the deal with that?
So there's loads of different things. So going to bed too early, low blood sugar, restless legs, sleep apnea, and then of course, anxiety perpetuating those nighttime awakenings. If the person's experiencing low blood sugar, did they eat their dinner too early? And then now it's their blood sugar low. And what happens is you can get a surge of cortisol, which can feel like anxiety. Maybe about an hour before bed is have a little bit of a high protein, high fiber snack. And that will help prevent that drop in blood sugar and that cortisol surge. Other things, so I'm a physician, right? So I'm always looking for like, okay, is there a sleep disorder? So, restless leg syndrome, kicking during your sleep, that's often associated with low iron, and low iron is often associated with anxiety. Also sleep apnea is when the airway kind of collapses during sleep and then you're just not getting enough air in, and that causes disruptions during sleep and also not feeling rested, feeling tired the next day. Increased risk of anxiety can happen with sleep apnea, and increased risk of depression as well. Interestingly, acid reflux and sleep apnea are connected too. So sometimes acid reflux can be a symptom or a sign of sleep apnea. Large meal 3 hours before bed is a good rule of thumb. And then a snack, like I was saying, about an hour before bed is a good rule. But don't eat right before you go into bed, because then you're going to have a higher risk of acid reflux.
So the second pressing question I have is sleep paralysis.
Normally during REM sleep, which is rapid eye movement sleep, our body is paralyzed. That's supposed to happen during REM sleep, so we don't act out our dreams and hurt ourselves or hurt our partners. But with sleep paralysis, we're getting this mixture of REM sleep and awake. So you're kind of partially awake, but you're paralyzed. That's why it's so scary, because you can't even talk. So the thing to remember is that these are actually benign conditions. Sleep paralysis, as terrifying as it is, it's benign. So again, this is why it's really important to, when you can, stay on a regular sleep schedule, work on your stress management during the day, and then work on optimizing those underlying factors that we talked about, your iron levels, your vitamin levels, vitamin D, vitamin B12, all of these things are helpful. But yeah, like you said, you want to just separate the anxiety from the experience, because these experiences are normal. They happen to most people.
That's a good line. Can I just ask one more question? Auditory and visual hallucinations when you're falling asleep.
So that's actually really similar to sleep paralysis. So where you get that REM intrusion, right? So you're kind of in this mixed state of kind of being awake in light stages of sleep, but then there's some REM sleep. It's totally normal. If you're hearing something, if you're seeing something, you might see a shadow or bright light, or you might hear somebody talking or feel like somebody's there. Very, very similar to the sleep paralysis. So again, it's normal, benign, nothing to be, super concerned about, unless you think you might have some sleep apnea or you might have some other condition. Then you can do a sleep study if you think there's something else going on to get that evaluated, especially if it's happening on a regular basis. As humans, we have a body clock that is slightly longer than 24 hours. And this is why it's really important that we stay on a schedule every day. Otherwise, the circadian rhythm can start to, migrate a little bit, and it can cause more sleep issues. So nightmares are a big one. We could probably do one whole webinar just on those, but I'll just say quickly, so there's a therapy technique called imagery rehearsal therapy. And essentially what it is you're re-scripting the nightmare to not be scary anymore and to even be happy and very positive. And then, making your bedroom a really safe and inviting place, making it into a place that you want to be, that you find safe and relaxing. And there's three things that really help to keep the circadian rhythm in check. So one is light. That's the most powerful. We call it like a timekeeper. And then the second timekeeper or time giver is food, so the timing of our meals. And then the third is activity and exercise. So pay attention to your own body. Notice how these things affect you. Notice your own system, right? You are your best guide. We can give you all these tips, but it's going to be different for everybody. So just really be mindful of your own system and how these things affect you. People who get tired in the afternoon, you can actually leverage that and allow yourself to take a bit of a power nap, which is generally 12 to 15 to 20 minutes. Don't take a nap for longer than 30 minutes, because then you get into deeper stages of sleep. So avoid long naps. It's going to take away from your nighttime sleep. It's also going to make you potentially more groggy when you wake up, because you're going to get into those deeper stages. You might feel more tired. So less than 30 minutes is ideal. And then don't take naps if you struggle with chronic insomnia. And here's tying back to the circadian rhythm piece, is get out of bed at the same time every day. And that's really important to anchor your circadian rhythm.
Like, what would you focus on first there? Would you focus on like the hours of sleep, or would you focus on like, this is the time I go to bed and this is the time I wake up?
So the first thing I recommend to people is get a really good sense of what your sleep pattern looks like just track it. So you can see how consistent it is. So you can track it with a sleep diary. The AASM, American Academy of Sleep Medicine, they have a free PDF sleep diary you can download. What I have found generally for people who are kind of nocturnal, usually they're getting enough hours of sleep. It's just that their pattern is totally off.
Right.
So what we start with is by shifting back their wake up time.
And can we talk about medication?
Okay, so medication I think of in sort of two categories. One is the prescription medication, and then the other type are the over-the-counter medications. So the prescription ones would be things like zolpidem, clonazepam, so the benzodiazepines and the non-benzodiazepine hypnotics. So those are that class of medication. Then the over-the-counter ones would be your Benadryl or diphenhydramine-based medications. So these are like your Tylenol PM, your Advil PM, that type of thing. Now, these sleeping pills, sleeping medications were never designed for long-term use. They've only been designed for 2 weeks of use. So they're very helpful for short-term issues with insomnia. But for people experiencing long-term issues with sleep, they can start to do more harm than good.
Thank you, Dr. Nishi. Thank you, Michelle.
Thanks so much for joining us. Bye.